Hi, my name is Deletnia.
Dominique,
Deborah,
Fabiola,
Karen,
Kate,
Kim,
Lorraine,
Louis,
Nick,
Nina,
Pamela,
Pat,
Carrie,
Robert, Sam, Tom,
Valencia,
William, and I want
To be chosen.
for the SEDA
Dental,
Extreme
Smile Makeover.
Every one of these people have an amazing story.
Have very bad teeth. I'm very embarrassed about them.
And I've had 5 major jaw surgeries from a broken jaw.
What this change would mean to me, it would mean the world to me.
Today was a tough day. We got to see some great finalists, and they were so deserving of the smile or a functioning smile that they wanted. But we can only choose one, and it's going to be a tough choice.
Everybody you've spoken to today hopes it's them, and I'm sure we all deserve it. But I hope it's me.
They have dental problems, and you want to just help everyone. But we got to choose that one person. SEDA Dental has been in business since 2003.
Thank you for calling SEDA Dental. This is Jackie. How can I help you?
I can't tell you how awesome it is to just change people's smiles and to hear the reactions and hear how it's changed their lives. It's truly incredible. Hey, Kath, how you doing?
Good, how are you?
Welcome back.
Recently, we treated Kathy.
I am a makeup artist. I realm in theater. I do makeup and wigs for opera, and I work with all the stars of the shows. Before I went to see SEDA Dental, I was completely unhealthy. I weighed almost 240 pounds. I had a mouth full of rotten teeth. As soon as I had to say something to anybody, I would shut my mouth and try to disappear into the background. It wasn't fun. It wasn't fun getting out of bed and going out in the house and seeing everybody else in the world being nice and happy when I was miserable, uncomfortable, and unhealthy. When I first walked into SEDA Dental, I was so nervous that I was going to be rejected. And yet, they didn't care what brought me there. They were just happy I was there and they could help me.
We've successfully grafted all your bones. When Kathy came into our office, she had so much gum disease that all the teeth were shifting at an alarming rate. So the first thing we had to do was remove her teeth. When we extracted those teeth, we gave her a full upper denture, and she felt comfortable immediately. So let's talk. I want to tell you where we were.
I went back in, and that's when he pulled the rest of the front. He put in the implants.
In Kathy's case, we placed 4 implants. It allowed us to take her full upper denture, and we were able to put the implants in, spread them apart, and allowed us to put a horseshoe denture in place that snaps in and out, and she's able to, A, feel more comfortable because it snaps in and out, and B, she's able to taste food because it has no palate.
And will be exactly like my real teeth. I can't wait to experience that.
Open gently.
To finally get the real teeth in so I can see what they're gonna be like.
We'll remove these guys. Bye-bye.
Instead of teeth that don't feel right,
Adios.
that they're gonna be able to snap in and I'm gonna be able to eat anything I want, talk, and feel the roof of my mouth and my tongue. It's exciting and nerve-wracking.
Bite is perfect. Tell me what you think.
Uh-oh. Wow. They're beautiful.
We were so inspired by Kathy's transformation that we actually sent her to have her hair done, to have makeup done, really just get all dolled up.
It's exciting, it's scary, and I kind of can't wait to see what they're gonna come up with.
Welcome to the Michelangelo Salon and Blow Dry Bar. I'm ready to go. How about you?
Yeah. When people have seen me that I haven't seen, they literally go, "Who are you? What happened to you?"
Kathy's dramatic transformation was the vision that Dr. Wang and I had to see if we can do the same thing for someone else who couldn't necessarily afford it.
It just inspired us to want to do more.
When I was told that I was the inspiration for SEDA Dental's Extreme Smile Makeover, and that they're gonna give an amazing smile to somebody is incredible.
The first part of the selection was an online audition to tell us why they deserved the Extreme Smile Makeover.
I have a bridge that's about 40 years old.
I have broken teeth in the back of my mouth.
The prednisone contributed to stripping away all of the enamel.
I've lost the majority of my teeth.
I can't eat normally.
I'd let it stop me from going to my oldest daughter's ceremonies at school.
As you can see, I don't have a good smile.
All these are rotten. Pretty much all my teeth are broken.
I really do need the help. I can't afford it.
We finally narrowed the selection process down to 19 contestants, and we brought them to our office to meet each one individually to find out why they felt they deserved the makeover.
So how did this all happen?
Years of drug addiction, bar fights that I used to do when I was younger.
I like that. It sounds exciting. Yeah. You got stories.
I've had Crohn's disease for about 30 years now, and the medications I had to take early on really just destroyed my teeth.
What's going on? Is it broken? Is it loose?
There are some that are broken. There are some that have holes in them.
I'm sure everybody you've spoken to today hopes it's them, and I'm sure we all deserve it. But I hope it's me.
Today was a tough day. We got to see some great finalists, and they were so deserving of the smile or a functioning smile that they wanted. But we can only choose one, and it's gonna be a tough choice.
Every one of these people have an amazing story, and we really took our time deliberating. Who's gonna get the smile makeover? They are just both amazing people. They're both amazing candidates.
It was really hard to determine who was the person that was gonna come on top.
There was one person who was living in pain and not only needed a new smile, but really needed to function in life again. And that's Sam.
Sam, you know what this means, Sam? Sam, you know who's getting an Extreme Smile Makeover?
Oh, thank you so much. Thank you. Lady, I got some camera people here, and I won. I'm from Kingsport, Tennessee. I have a wife named Shay, a 1.5-year-old baby. I was just brushing my teeth one night, and pop, one fell out. And it was this one right here. And when it fell out, it just sort of shocked me. I knew my teeth were getting bad. I'd be eating something, one will break. My teeth was crumbling. I heard of people going to the hospital before, and they'll refer them to a dentist. I was in there for about 10 minutes, and they sent me home. It's like, we just have nothing really we could do for you. My teeth decay is contributing to my health. I'm in pain almost every day. Sometimes it's like a baseball bat hitting my face. I've always got to be conscious of people not seeing my teeth. When we take Facebook pictures, we edit our photos because I don't want my baby to have pictures of her daddy with missing teeth. I found out about SEDA Dental Extreme Smile Makeover through my wife. Because she said, hey, it's worth it. Let's give it a shot. My name's Sam Quillen. First of all, I'm going to show you my teeth. We took 3 or 4 takes, and then I said, all right, let's just go with this and put it on there and see what happens. Then everybody on my Facebook, my friends, my family,
It's okay.
they all chipped in, and it sort of exploded.
Sam is not only living with bad teeth. This is the gateway to infection throughout the rest of his body. Not only does he have pain, he's got constant bacteria in his mouth that can lead to other bad things, like heart disease, stroke. It's dangerous.
He needs to get rid of all of his upper teeth as soon as possible. The sooner he gets rid of them, the better off he is.
How many teeth are we looking at pulling?
The top, 10 and 11, we're extremely excited from an emotional standpoint, so I can only imagine what he's thinking, what he hoping to achieve and get out of all of this?
I've tried and tried to, get a lot of help and stuff, and now finally SEDA Dental is gonna give me a hand, help me out. I can't wait to get started. Can't wait.
How long has it been since you had your last dental exam and a good teeth cleaning? SEDA Dental is now offering a new patient special for a comprehensive dental exam. X-rays, teeth cleaning, and polishing.
Getting regular checkups and regular cleanings can lower your risk for heart disease and various other diseases.
The more often you get a cleaning, the healthier your body feels.
So having good dental hygiene is not only important for your oral health, but your overall health.
We have a maintenance program, and it is probably the most important thing we do. Our specialty is periodontics. We find it extremely important to take care of the foundation, which is your gums and your bone.
SEDA Dental has multiple offices around South Florida. What you can expect is a certain type of experience.
The SEDA Dental experience is a great one. Our staff is highly trained and we're all very sweet. It's warm, it's comfortable.
The SEDA Dental experience is amazing. It's like having a second family here, and we all work together to provide the best care to the patient.
With multiple SEDA Dental offices throughout South Florida, our professional staff is ready to consult you about your personal dental situation. Ask about our new patient specials by calling 877-987-4321 or visit floridateeth.com and take the first step to a happy, healthy smile.
That sweet smile.
Looks like we won a lot, and I can't wait to be able to get this and smile.
Same. Congrats, man.
Oh, thank you so much.
This is super exciting for us. Now, you have a history of really bad teeth for a long period of time. What we're gonna do is get you out of pain.
So as far as today, we're gonna get some impressions first.
Okay.
When we took impressions, that allowed us to look at the study models so we could look at his teeth outside of his mouth and make sure he was a candidate for whatever we wanted to do. The next time you come in, we're taking out back teeth behind your canines. Our first surgery involved removing 11 of Sam's teeth. Good morning.
Good morning.
You did great. Tooth's out.
Yeah?
Yep, congratulations.
All right.
One down. This root is sitting right under the sinus. So I'm gonna grab your nose, open as big as you can, breathe in. See that? So that means your sinuses are intact and there's no perforation. Just taking out the last root tip, we're done. There you go. Do you want to do it now?
I'm good.
I never met a guy who likes to take his teeth out. 1, 2, 3. And this is gonna be the cleanest you've been since birth. You got me?
Mm-hmm.
Couple stitches, we're done, dude.
They took out 11 teeth, and I can't believe it. It was pretty painless, All I did is feel the pressure.
There were no sinus perforations, which is the most important thing. It couldn't have gone cleaner.
Oh, you see Daddy? Hey, how are you doing? Long time no see.
Once he healed, and those 11 teeth just healed amazing, we took impressions, and we sent it to the laboratory where they were able to fabricate a full upper denture.
I am really excited about the next step. The next step is going to be a lot about me smiling and stuff. I'm going to have a full set of teeth.
We removed his remaining teeth. Thank you. His all upper body strength. Inserted the denture where he can live comfortably for the next few months prior to placing implants. How freaking good this is. Big smile. He's got a full set of teeth. It's amazing.
Oh, I haven't been able to smile like that in a long time. I just couldn't believe I was even looking at myself. I haven't had this many teeth in years. The last time I was here, they took all my teeth out from the top of my gum. Then they gave me the denture, and immediately, I could see that I was able to smile.
Sam.
Hey, doctor.
What's up, my man?
Looking great.
You lost a ton of weight.
Yeah. So once they gave me the denture, I started being a little more ambitious and putting myself out there, really looking for that great job, that career job, and it all started with my teeth.
You know, my teeth changed my life.
No more bad teeth, healthy gums. We got really healthy bone. Once I saw Sam heal, I felt very comfortable going back in surgically and placing 4 implants.
For that denture that we're talking about, right? Looking good. Looking real good. Perfectly parallel to where they're supposed to be.
The surgery was a success. The bone looks awesome. The implants are completely stable. I was able to place 4 solid implants. Okay, real solid. And remember, the final goal is going to be to utilize those 4 anchors or those 4 implants and a denture that's going to snap in place. If you think that your quality of life has improved up until now, just wait till we're done. You're going to be smiling.
Yeah.
Even more than you are now.
It's awesome. You know, it's very appreciated.
This Extreme Smile Makeover contest was extremely difficult to actually choose the person for this reward.
Dr. Wang and I sat down and decided there could be a second person who's deserving of a smile makeover. How you doing, okay? Hang around to see Sam's final transformation and to see who else we picked for a SEDA Dental Extreme Smile Makeover.
Do you have a missing, broken, or damaged tooth? If so, you're not alone. 70% of Americans have at least one missing tooth. But when that tooth is not replaced, the jawbone deteriorates. Dental implants are a long-term solution that stimulates natural bone growth and slows down the progression of bone loss.
Dental implants are basically an artificial roots of your teeth. They act as the foundation. It allows for better chewing.
Only dental implants provide the form and function of natural teeth. SEDA Dental can help you restore your natural smile. SEDA Dental is a leader in surgical and restorative implant dentistry throughout South Florida.
I've been placing implants for about 20 years now, and our success rates have always been amazing. We can offer someone success rates high 90%. The technology on dental implants today has changed dramatically. Our technology has become incredible. We can give somebody something much quicker than we did many years ago.
SEDA Dental is offering free consultations and exams at all of our convenient South Florida locations to see if you are a candidate for dental implants. Call us today. Call 877-987-4321 or go to floridateeth.com to see if dental implants are right for you. And don't forget to ask about our affordable financing and custom payment plans. SEDA Smile, SEDA Difference. SEDA Dental.
That sweet smile.
SEDA Dental giving this opportunity is just great. I've never heard of the competition before. Now, but to choose people and to help people out that is in need, I think it's just awesome.
And Sam was the one that we picked, but at this point it was so difficult that we felt there was another contestant that we wanted to help them along.
This decision isn't just based on a smile. Delania, how you doing, okay?
Yes, doing great.
I got some good news and bad news.
I heard about the SEDA Dental Extreme Smile Makeover from a friend in New York, and she just posted it on Facebook. And I said, you know what? Why can't I audition for it? I've lost the majority of my teeth.
The bad news is we're going to get a chance to know each other. The good news is you've been selected.
What?
Yep.
I am so excited.
So are we.
They were only going to pick one person. They chose to help 2 people out when necessarily they should have just helped 1.
Congratulations. How you doing?
And the fact that they chose me just makes me feel like, wow, these people are amazing.
I know, I'm so excited.
We just felt that it was basically our duty to get this done for her, because to worry about one less thing would only help her struggles and fight for the positive and for her life itself.
I was diagnosed with stage 4 leiomyosarcoma cancer. I was told I had a 15% chance of living. It's like the world ends and you just don't know what to do. It was best that I did get a full hysterectomy and 6 inches of my small intestine removed in order to save my life. With the chemo and with my previous dental issues I have, it makes things worse. Economically, it's been very difficult being that I was working full-time. The doctor comes and tells me, now I'm going to consider you disabled because we can't have you working that many hours and so much stress on your life, and seeing if you qualify for Social Security at 33.
You spoke with your oncologist?
Yes, I did.
And how's everything progressing in terms of your
Great.
cancer and
Everything's
remission?
great. Still NED, which is no evidence of disease.
Perfect.
Thank God I have no cancer cells in me, and all my tumor markings are coming back negative, so that's great.
Today, at least, what we're going to do is get some impressions so we can have a good sequence of events, what to do next.
Next time we see each other, we're gonna have a long day.
Okay.
Our team's gonna get together, we're gonna extract all your teeth and give you a one-day SEDA Smile.
Okay.
Next time we see you, you're going to have teeth.
Awesome.
So we're on the road.
That's crazy. How fast.
Yeah.
At my first consultation at the doctor's office, I was able to meet Kathy, who inspired the whole entire SEDA Dental Smile Makeover. And through her, we made this awesome connection, and we started talking, and she explained to me that she does wigs. And in my case, a wig is something that I need. When you lose your smile and you lose your teeth or you lose your hair, you lose a little bit about yourself. It feels like something's chipping away from you.
I love it. I think it's important that we share our stories, experience, strengths, and hope. She's got some strength and courage that I think we all need.
Good afternoon, Delania. How you doing?
I'm good. And yourself, Dr.
Excellent. Do you know what we're doing today?
Yes.
We're basically going to take out all those bad teeth that you have left
Yes.
on the top, and then we'll put in the implants, finish you off with some teeth. We took out basically all of our upper teeth, and they weren't easy teeth to take out because some of these teeth were broken down below the bone level, so we have to go inside and really dig to get it out. It was a tough procedure, but I knew she can take it because of what she went through in the past. We were able to place 6 implants. Even though it's called all on 4s, I like to put a couple more to ensure success.
How's it going, guys?
We're almost done.
Did you angle the implants as well?
Two of them in the back, so we didn't have to do a sinus lift to avoid the sinuses.
Wow, that's great for her.
As soon as I placed the implants, the second part of our team comes in, our prosthodontist, and the lab was able to configure the prosthesis so that it would fit in a custom fashion. And everything else was basically lined up properly.
Listen, the steps up to this day, which was the preparation stage, was the most important. The fact that we could sit down and do this in, what, 4 hours?
Yeah, amazing.
Pretty amazing.
And I have a full set of teeth like this.
Yeah, so you got a full set of choppers that you haven't even seen yet.
No, I haven't.
Let's take a look.
Wow, they look natural. I look beautiful.
You look beyond beautiful. You were beautiful before.
Honestly, this procedure was better than I thought. In my mind, I created this world where everything was gonna hurt, but it didn't hurt at all. I've been waiting for this day for a long time. This just makes me feel better.
The most inspiring thing about Delania is her positive attitude. Is amazing.
That was perfect. The other one. Today I'm so excited. I'm finally getting my new set of teeth. I cannot wait.
Delania, how you doing?
How are you? I'm doing
Pretty good.
great.
Excellent, excellent.
Yay, I'm excited.
So what we're gonna do is take out the temporary teeth that you have on now, unscrew it, and then put in the final teeth. And
Okay.
make some minor adjustments, and you're basically good to go.
It's a quick, easy process. No pain, no shots, just easy.
All right.
Whoa.
Yeah, I
Nice.
That's awesome.
know. Do they look good?
They look good.
Oh, wow. They look natural.
Very natural.
Thank you. This has been the best experience. Thank you to your staff. Thank
You're
you
welcome.
for everything you've done. This is life-changing.
We're happy that we can help you.
Yes, you have. Thank you so much. SEDA Dental is amazing that they take their time and they give back to the community. They're able to help people and change their lives. And that's what they've done for me.
Showtime, baby.
Oh, I can't wait. Where we started, now where we're at, it's so awesome. Such a transformation.
Hang around to see Sam's final transformation.
Frustrated with loose and missing teeth? But you can't stand the idea of having dentures? Or perhaps you already have ill-fitting dentures and want to have fixed teeth that look and feel like your own again? Then the one-day SEDA Smile may be right for you. With the latest dental implant technology, SEDA Dental can replace your missing or loose teeth with fixed, non-removable teeth all in the same day as you receive your implants.
Place the implants in such a manner that they are able to house and hold full complement of teeth in one day.
We are offering free consultations and exams at all of our convenient South Florida locations to see if you're a candidate for the one-day SEDA Smile. Call 877-987-4321 or go to floridateeth.com to see if dental implants are right for you. And don't forget to ask about our affordable financing and custom payment plans. SEDA Smile, SEDA Difference. SEDA Dental.
That sweet smile.
Here it is. Here we are. Let's go see the dentist.
Sam came in for his final transformation today.
How are you?
I'm doing great. How are you doing?
Good. Ready? Today's the big day.
Big days.
From the beginning, when Sam came to see us with that advanced periodontal disease, teeth that were moving back and forth, missing back teeth.
There's maybe 1 or 2 good teeth on the top, possibly, but
he didn't have any ability to chew. It was a mess.
And from a health standpoint, it was also a very, very dire situation.
Sam, you know who's getting Extreme Smile Makeover?
The fact that we can give somebody something where there are no strings attached, and to watch that person change their lives is an amazing feeling. Showtime! How psyched are you?
Oh, I'm very psyched. It's so awesome. Such a transformation.
Hand them over, baby.
Hand them over.
Great transitional thing to get us to where we are, right? But this palate, it's out of here. Like taking out his teeth. You could see that he's a new man. Here it is. Wow. Worth all the weight in gold, my friend. No palate. Teeth custom made just for you.
Almost like you won a lot, you know. And I can't wait to be able to get this and smile.
Relax your cheeks. Awesome. This is my favorite part, a little click. You hear that click? Mm-hmm. Awesome. Man, I love what I do. Here comes the mirror.
Hot damn, look at that.
He looked at it. How could you not fall in love with it? Awesome. Great feeling. Just the end result, phenomenal.
That is so great. Wow. And they look so natural. I love it. Big change from where I started, though.
You're talking great. You look good. Man, does he look good. Functions perfectly. Look is awesome. He's gonna have a great life.
Oh my gosh, look how nice
you see Daddy's teeth? He's got to be the greatest dentist in the world.
I am so happy with my team. With the SEDA Dental Extreme Smile Makeover, everyone came together and delivered the most amazing smiles for Sam and Delray.
I feel like a different person. I feel great. I feel awesome.